since you start with a personal story, how did you get into this? Tell us about your kids, your schools, and that's kind of what launched you into this.
Yeah, at the very beginning of the pandemic, yeah, I sort of went along with everyone else with what we were told to do, and that also involved school closures. My kids were in 3rd and 5th grade at the time, and it was very obvious, basically immediately, that this was not going to work for any long period of time. But, I was happy is not the right word, but I was certainly agreeable to go along with everything. I was not knowledgeable about what was going on with the virus or other things. I had limited information. What really set me on the path was watching my kids by themselves, basically wilting away in front of the gray light of a Chromebook, each of them. And, my son, who was in 3rd grade, I mean, he finished his quote unquote remote learning in like 10 minutes. And so it's like 9:30 in the morning. And he's like, okay, I'm done. Now what do I do? It was a problem. My wife and I were both working. I'm like, I don't know. You couldn't play with any kids because everyone was barred from getting together. So it was obvious this was going to be challenging. Now, the flip side of it was, well, we're presented with this new virus. We were told this is very dangerous. This is what we need to do. So this was the sort of trade-off that we were told needed to happen. But I'm someone I've spent a lot of time reading scientific journals, interviewing academics in a variety of fields. I'm familiar with looking at evidence and data and research. And this was such an extraordinary moment we were in our country that it was impossible for me to not start digging into this myself, just to try to get my own sense of what was going on, not just rely on media reports. And very quickly, it was clear that kids were at extraordinarily low risk from this virus, basically the same risk they are to any number of other things that they face in life and a given day. And that adults also were generally not at great risk, a healthy middle-aged adult. And moreover, it started becoming clear that closing schools was not going to be a particularly effective mitigation measure either. And so that kind of started me on my path. And there are a couple moments, and one of them where things really shifted for me. And one of them was, and we can get into this, Michael, if we want, was, remember the flatten the curve meme that we were told about, that if everyone just follows instructions, then the cases won't spike. You'll have this gentle slope and the hospitals won't be overwhelmed. And if you don't follow instructions, then they could spike and we're going to have a problem. And then we had 15 days to close the spread. That was the catchphrase we were told. But you may remember this, after the 15 days expired, they immediately added another 30 days on. So that started kind of my ears sort of perked up, when that happened. I'm like, okay, that's interesting, because we were told we're just slowing the spread, but for 15 days, now we're going to add on another 30 days on top of the 15. And there didn't seem to be very much pushback or questioning of this as far as I was observing. And so toward the end of April, I was talking with a friend of mine, and at that point, cases in New York City had dropped something like 50% by the end of April. I mean, it was just like off a cliff. And I said, oh, well, I guess the kids are going to go back to school now. And, I'm sure they'll be opening the schools any day now. And he was like, Dave, they're not going back. And I was like, well, what do you mean? He's like, said they told us we just had to flatten the curve, and we did it. The curve is flattened. And that sort of was the moment for me, I think, where I really realized, okay, something's wrong here. We're in this for a really long term, for some unknown length of time. And these people, we don't know what they're going to do or what's going to happen. Once I saw that we did what we were told, we achieved the thing we were supposed to achieve. So we were told to stay home and we did it. And I live right outside New York City. So we were told to stay home, we did it. And then we were told the whole purpose of that was to flatten the curve, and that was achieved. And yet they still just kept continuing on. To me, that was very worrisome when, the cliche is moving the goalpost, that we achieved the thing we were supposed to, and now all of a sudden we're just going to keep going. So I began writing articles about this. In the beginning of May, I wrote a piece with basically filled with a compendium of evidence about why the school should reopen, and I kind of went from there.
Yeah, it's an amazing, amazing story. You keep asking why, and you get this kind of circular citations. Well, because the CDC said so. Well, then, where did they get that information? Well, this other source said it. Then you go to that source, and this other source said it. You end up in this kind of loop. I like that that little graphic you have here with the kind of
That's right.
responsibility arrow. CDC, don't blame us. We only make recommendations. Each school can make up their own decisions. Take it up with them. You go to the schools and they go, don't blame us. We're just following the CDC's recommendations. Take it up with them. It's so funny.
Exactly. Well, and sad.
Yeah. Okay. So bigger picture. So the COVID-19 emerges from a lab. Oh, I'm sorry. It leaked out of a out of a wet market with people eating bats sometime in the fall of 2019. Gets to America, probably through Seattle, maybe in early January. By March, it has spread everywhere, and they closed the schools. The idea, again, was just a few weeks, maybe a month or two. Certainly by the fall of 2020, everything will be back open. All right, what actually happened?
Yeah, so the entire school system in the United States shut down. This is just an absolutely extraordinary moment. And what happened was, in the end of April, beginning of May, schools began reopening in Europe. 22 countries there started opening schools in the spring. And the education ministers of the EU met in May, and they said, we have observed no negative consequences of this. We haven't seen a spike in cases. We're not seeing any problem with this. They met a second time in June. They had the same response. We've got 22 countries, schools are opening. We're not seeing any consequences. Simply opening schools has not led to any sort of noticeable effect. This news was ignored in the United States. There's virtually uncovered, not covered is what I mean, virtually. And it's quite an extraordinary moment that we were told that we couldn't open schools for any variety of reasons, but yet we had another continent. This was not, one random little schoolhouse in Albania or something with 12 kids. This was millions of children. And, we can get into it, Michael, but either this was ignored, and when it wasn't ignored, it was waved away that's Europe. We're not supposed to listen to them. That doesn't matter. That doesn't count. And they gave a list of reasons, and each of those reasons were bogus. There was no evidence behind these, and that's, I think that's why I'm on the podcast with you, that I came at this topic apolitically. I don't have an agenda. I wasn't trying to win points for a side. What I wanted to do was follow the evidence. And the whole book is really almost an epistemological type of study where I ask, how do you know what is true? How do we make that determination? How do we think about evidence in the world? And how do we make decisions when there's limited evidence? What is the sort of appropriate course on a policy level, on a personal level, and on a moral level? Sort of when you think about bioethics, how do we make these types of decisions when we don't have all the information that we need? And how do we think about evidence? And what I show extensively in the book is that our public health authorities, that quote unquote experts, were completely divorced from what we call evidence-based medicine or evidence-based public health. Much of what we did was based on intuition, was based on theory, was based on a lab test or study, and they completely ignored empirical evidence, like I just stated in Europe, where you have millions of kids in school, and then later in America, in mostly red states and red areas where kids were back in school. And again, all along, there was no observable negative consequence of this. They highlighted if there was, and we can get into this, the media would highlight if there was an outbreak in a school. That's evidence that schools are super spreaders. But what I talk about is that there was no there was no denominator. We called it the missing denominator. That, yeah, there's an outbreak in a school, but you're not talking about the 500 other schools in the same state that are open where nothing happened. But the media is only interested in the thing, in the anomaly. So the anomaly becomes the story, but they leave out the numerator. They focus on the numerator, but they leave out the denominator. They leave out the larger pool of everything that's happening where there's no negative consequence. So there was an extraordinary amount of misinformation, I would call it, or lack of information given to the American public. And much of this was perpetuated by the public health authorities and the broader public health establishment. And that to me is the most upsetting and destabilizing component of this, is that, it's very easy for people to point at QAnon or some other, conspiracy theorists and say, oh, that's fake news, that's misinformation, et cetera. What's far, far more problematic is when we see information that is being overstated, information that does not reflect the evidence base being put out by people who we're supposed to believe in as the experts.
Yeah. Yeah, I like that discussion in your book about epistemology and the philosophy of science and how do we determine what's true in medical science. And in medicine, the randomized controlled trial is the gold standard. But of course, we can't do that. You can't give populations COVID-19 any more than you can force some people to smoke or some other people to get divorced or buy guns or not. But you can look at after the fact, here are populations with these differences. Let's see what the outcomes are. So that's the comparative method. And that's all we can do in a case like this with an outbreak. So when it became evident that all these schools were reopening in Europe, I guess Sweden is the model one, but there's Germany and Italy and others, and they must have had some variation in outbreak rates. Why did not the CDC go, well, there's our evidence. That's our standard here. This is how we determine what's true. And they've run the experiment for us. We should take that information. Surely they knew that. They must have known that by late spring of 2020, or at least by the summer.
I mean, it's quite extraordinary that you had this meeting at the EU and there was basically crickets from the American health establishment about this. And moreover, you didn't even need to watch that meeting or listen to the announcement. All you had to do was look at the overall prevalence of the virus in Europe, and it actually had gone down after schools were open. Now, I'm not suggesting that opening schools causes a virus prevalence to go down, but what I am suggesting is surely schools were not these catastrophe zones where super spreader events were going to constantly occur, where they were going to just, explode the pandemic. It didn't happen. Again, there's no way that cases were going to go down after you open schools if they actually were that problematic. So the evidence was plain to see. It was both announced by these people and it was plain to just see when you looked at it, and it was basically ignored. And as I mentioned before, when it wasn't ignored, we were given a list of reasons why we weren't supposed to acknowledge this evidence. We were told, Europe, well, that's because they're controlling the virus there. It was never defined what controlling the virus meant exactly. But what I show is, if you look on a population level, at a country level, yes, some countries did have a lower case rate than the United States. But there were other countries that opened schools that didn't, number one. And number two, that's like, America is a large place. And the idea that we were going to have one case rate for America as our metric, rather than taking the read of things on a location by location basis, made no sense. Why should the case rate in Brooklyn affect schools in Baton Rouge? There was no logic behind this, in the same way that different countries in Europe weren't necessarily going to affect each other. So the argument that they had controlled the virus, which we heard a lot, that expression, was simply specious. There wasn't really, there were untold numbers of large cities, medium-sized towns, and little towns that had, a mirror community in the United States that had similar or lower case rates. and it didn't matter. So we had a perfect sort of, open study, if you will, kind of like a natural experiment. It's not a randomized trial, but in some ways it's better. There didn't even have to contrive a trial. This was just millions of kids back in school in a whole variety of circumstances. Many of them were not wearing masks. The ECDC, that's Europe's version of the CDC, had actually recommended against kids in primary school wearing masks. They were oftentimes not socially distanced at 6 feet, which we were told was, absolutely critical to stay 6 feet apart. And because of that 6 feet of distancing metric, many kids couldn't go to school, including my own, or you couldn't go full time because the classrooms had to be half empty in order to accommodate this 6 feet of distancing between each student. But yet kids in Europe, by and large, were not adhering to that. They were at 3 feet or 1 meter, or oftentimes no specific distance at all. We were told we needed HEPA filters, these, special filtration on the HVAC systems. They weren't using that in Europe, by and large. This was not covered throughout European schools where they had HEPA filters. We were told a whole variety of things. They had barriers on desks here and in many American schools. That was not done all throughout Europe. There were plenty of schools there that weren't using this, and there was no noticeable consequence. Each of these interventions that we were told were critical to be put in place and that schools could not open until we did these things, each of them was made up. There was no evidence that they were going to be beneficial. And conversely, we had actual real-world evidence where they weren't being used, that there was no negative consequence of them not being used. So you had evidence on both sides of the coin here showing that these were absolutely not necessary to open schools. Yet nevertheless, this is what the experts told us over and over again. And this is what the media also repeated to us over and over again, that we can't open schools until they're quote unquote safe. And in order for them to be safe, you have to meet these variety of criteria. This was all made up.
Astonishing. Yeah, when that outbreak happened, I was teaching at Chapman University. My Skepticism 101 had a Think Like a Scientist class, and I was lecturing on Bayesian reasoning and signal detection theory. So I presented the COVID outbreak in this way. So imagine a 2x2 cell. So you have 2x2 matrix with 4 cells, 1, 2, 3, 4. The top two, COVID-19 is going to be massively deadly. Maybe 10 million Americans will die, and so on. So you shut everything down, close the schools, close the economy, masks, social distancing, the whole thing, and you save 10 million lives. Well, that's a hit. That's good. But if you carry on as usual, and it turns out to be super deadly and 10 million Americans die, that's on you, the public CDC or the politician, the mayor, the governor, the president said, all right. But in the other 2 cells, it turns out to be mild, maybe slightly worse than the flu, what it was. And we shut everything down. Well, that's a big miss. And here, I think one of the things you point out in the book is that people were not taking into account what is the cost of shutting everything down, closing schools, the economy, inflation, social isolation, suicide ideation, and actual attempts, and depression, anxiety, all these things. And then the fourth one, everything is fine because we carried on as usual and it wasn't that deadly, but we didn't do that. So the way you present it just now, and also in your book in great detail, it's, at the time I was trying to give politicians and medical policymakers the benefit of the doubt. They just didn't know. But it seems pretty clear by summer of 2020, they really knew. So the way you present it, it's not that they just didn't know or they made the wrong decision on the matrix tree. And maybe 2 years later, 3 years later, now we know, no, they knew. So either they're lying or they're just greatly self-deceived through all the confirmation bias and all this stuff you talked about. Or worse, I don't know how far you want to go with this because I had a guest on the podcast that suggested a conspiracy. They knew and they wanted to make us mask and social distance as a way of controlling the population. If we can get these people to put a mask on, oh boy, we can really take away their freedoms one by one, and so on and so forth. So speak to that.
Yeah, I'm careful about a sort of a broad they, because the public health establishment is composed of many, many people. So it's hard to know the impossible to know what's going on in all these people's minds. What I talk about a lot in the book is, and you just touched on this. I think there's a lot of self-deception, a lot of motivated reasoning that goes on in people's minds. And I give lots of examples in the book, and I hope all your audience will buy the book and will read it. Because what's fun about it, I think, is going through history and looking at how did we think about evidence years ago? How did we come to where we are today? And what is it about human intuition is often wrong? And I give basically endless examples of this where, and particularly when we think about medicine, where things that seem obvious that they should work, often that's not the case. And, and I give lots of examples. You can go something with like peanut allergies. They started watching peanut allergies go up in America. So the advice was, well, don't give peanuts or peanut butter to infants. It's dangerous. We got to watch them until they get older. Now, of course, that was the exact opposite of what should have happened, that when little kids are exposed to allergens or other things when they are very little, that actually trains the body to not overreact to it, that actually reduces the rate of allergy. And sure, and ultimately they reversed their guidance, but it was 20 years or something that had passed where they had the opposite advice, that they were actually causing more peanut allergies and causing harm in American children. They had, there was advice for a while that kids should sleep on their little babies should be on their stomach because that would prevent sudden death, to prevent kids from choking on their vomit. There was never any evidence for this. It made intuitive sense. Okay, that makes sense. A kid, you're on your stomach. If they throw up, it'll come out. But it turns out that's not the case. And there's case after case after case where things that might seem obvious, perhaps like closing schools. Yeah, that makes sense. There's lots of snot-nosed kids in there. If we close, yeah, that's going to reduce the transmission of a virus. That makes sense. Wearing a mask. Yeah, maybe it won't work 100%, but if we put it on, it might have some benefit. Lots of these things make intuitive sense.
Are the barriers on the cover of your book.
That's exactly right. Or you having a child forced. Those make me very angry. The idea that my kids had to sit with their heads inside of these opaque barriers. It's like, what horse blinders are. When you have a horse, they had these things. You had zero peripheral vision. Your head is inside these barriers all day. So these things those actually don't make intuitive sense. Those were just absurd from the beginning. But some of these other things, you might think that they'll be effective. And it turns out our intuitions are often wrong. And how do we find out what's true? Well, you have to do real science, whether it's a randomized trial or some other experiments where you can actually prove things out. And unfortunately, in America, we operated based on intuition rather than based on science. And what I talk about a lot in the book, and what I think is important is, well, how did this happen? Why did we come to this place? And unfortunately, a lot of it had to do with a political tribalism in our country. And very early on, the American Academy of Pediatrics had put out a statement saying, we need to get the kids in school. Like, this is incredibly important. Don't even worry about 6 feet of distancing. If you can do it, great. But if you can't, 3 feet, that's probably fine. It's not worth the whatever minuscule benefit there might be for the additional feet. Don't worry about it. Just get the kids in school. Shortly thereafter, Donald Trump tweeted, open the schools this fall, in all caps with exclamation points. And within days, the American Academy of Pediatrics reversed its guidance. Gone was the mention of get kids in school no matter what. Gone was this idea that you don't need to adhere to 6 feet of distancing. And instead, they said, we need money, lots of it, before schools can open. And they said, you need to listen to the experts. So it was quite astonishing to see this reversal. And it was immediately after Trump's tweet. There was no ambiguity that this was related to the tweet. And I'll give you another example. After I started writing a lot of articles that were challenging a lot of the accepted positions on what was happening, people started reaching out to me from around the country, including a lot of doctors, and not just a suburban pediatrician, but people who are working at top medical institutions, elite university hospitals. And they would say to me, thank you so much for writing this article. What's happening with kids, this is wrong. I don't think this is beneficial, keeping the schools closed. I don't think there's any, epidemiological benefit to this. I think there's a lot of harm. I don't see the value in having these mask mandates on little kids, and whatever the list of things might have been. And they would say, but all this is off the record. You can't write about this. You can't talk about it. Because most of these people, their environment that they operated in is so politicized that to say anything that went against the CDC or Anthony Fauci, and conversely to say anything that may have agreed with Trump, meant you would have been an outcast. It was unacceptable just socially and professionally. And on top of that, there were plenty of physicians who told me that they were point blank explicitly admonished by their superiors at the hospital or wherever institution they were working that said, you are not allowed to speak out against the CDC guidance, period. So I had this bizarre experience where I was aware of this dissent among some doctors. It wasn't, the majority of them were still going along with what was going on, but there was a significant minority who had a problem with what was happening, but were either afraid to speak out or were point blank told that they were not allowed to speak out or they could have suffered professional repercussions. So I'm experiencing this at the same time where I have this knowledge of what's really going on, but yet in the media and everywhere else, you're hearing about this medical consensus. Experts agree, ... But this was actually a false consensus. It was a manufactured consensus that the American public was told existed on a lot of these interventions.
Yeah, trust the experts. Okay, so why, when Jay Bhattacharya and his colleagues published the Great Barrington Declaration that countered the CDC? I mean, he's not Alex Jones on Twitter or, Del Bigtree, an anti-vaxxer. He's got a medical degree and a PhD in economics at Stanford University. Why was he not considered an expert?
Right. Well, those were the experts that you were supposed to ignore. And I was there in Great Barrington with Jay and Martin Kulldorff and Sunetra Gupta. And look, people can argue about whether their approach was that they advocated for, which was to focus protection on vulnerable people, but let the rest of society continue on. If you wanted to stay home and you had the means to do so, go for it. But they didn't want to have this thing where people, including children, were prevented from conducting their lives when they were at such a low risk from this virus. Let them decide. Those are values-based decisions, not science-based decisions. And one of the things I talk about in the book a lot is this difference. There was a conflation of the idea that science, quote unquote, tells you what to do. That Andrew Cuomo in many instances kept saying, follow the science, follow the data. That's what you do. But the reality is science doesn't tell you to close schools or open schools. It doesn't tell you that. It gives you information, but then you make a choice based on your values what to do with that information. But that was conflated by a lot of people during the pandemic. And if you disagreed with these people, you were a piece of garbage. You were some right-wing crank. Who are you to be questioning, keeping schools closed or not? Again, if you imagine some 75-year-old grandmother who was living alone, and they were telling her, you can't see your family, it's too dangerous, you can't go out, stay locked away. Well, maybe she was in ailing health. Maybe she felt like, you know what? I've got a 1 out of 100 chance of maybe getting really, really sick from this thing. I'm going to take those sound like good odds to me. 99 out of 100. I'm going to go with that because I want to see my family. I don't know how many years I have left. It's important to me to spend time with them on Thanksgiving or Christmas. That's a value decision that people should have been entitled to make, including parents with their children. That if you wanted to keep your kid home from school, go for it. If that's what you feel you needed to do. But the choice for parents was taken from them. And we have been told that education is a right in our country. It's not a privilege, it's a right to have an education and to be able to go to school. And that right in America was taken away from many, many children. Kids in the red states, kids who went to private school, they could still go to school. But kids who were underprivileged, who didn't have the opportunity to get into school, or kids who had the misfortune of living in a blue area or a blue state, they were disadvantaged. It was extraordinarily class-based, the way our policies were put in place during the pandemic, and no one was hurt more than these underprivileged kids from these interventions.
Yeah. I think part of the problem also is that it was treated as a collective action problem in which we all have to get behind this. So analogously, paying taxes in order to support, the road construction and whatever the infrastructure of the society, it can't be voluntary because we know what will happen. Or, we're all going to drive on the right side of the road. We can't say, we recommend you drive on the right side of the road, or we recommend you drive under 70 miles an hour. But, if you want to go 120, go ahead in the left lane. That's never going to happen. And I think the COVID-19 got put in that bin of, this is something we all have to do. Because if you don't do it, then you might be fine, but your grandma's going to die, or these other people are going to die. So you all have to do it.
But this went against all of the history of bioethics, the idea that you were telling children to make them feel responsible for the health of others. That is not how you're supposed to act in a public health context, where you tell a little kid, you're going to kill somebody if you want to go to school. That's not how it works, generally. And many ethicists would argue that's not how it should work. And the reality was that this was never going to be effective because people don't comply with instructions to do things that are unpleasant and difficult. We know this when I talk about this a lot in the book with what's known as implementation science. There are people who study this where if you're given an intervention, if you're told you have to take a fistful of giant pills, and they're going to give you, horrible nausea, and they're going to give you, pains in your joints, a certain number of people are going to fall off. They're just not going to comply after a while. Well, it's the same thing with these interventions that people, and we saw this with the mobile phone data, even before they started opening things up policy-wise, people started moving around anyway. Why? Because that's what human beings do. That people don't tolerate well things that are uncomfortable, that are difficult. And one of them is sequestering yourself or your family. There are some people who can tolerate it and they have the means and the desire to do it. But we know this just from the mobile phone data. That's not how human beings operate. And sure enough, even from day one, by the way, there was a significant portion of our country that still was out and about working. So while the laptop class could be home and could conduct work on Zoom, and their children perhaps were in very comfortable bedrooms or they had tutors, there was a large portion of our country who was delivering the food to those people while they were home watching Netflix, who was working in the slaughterhouses, who were keeping the lights on, who were fixing the plumbing, who were cashiers, and so on. These people, they were still out and about. Well, what happened to their kids? Well, either A, they were home alone all day, or B, they went to a grandmother's house. They went to a daycare that was mixed with kids from a whole variety of neighborhoods. So instead of just being with the kids in your cohort in your school, now you're mixing with more kids. So I write about this, how this hybrid model that they tried to implement in so many schools in America, including the schools that my kids went to, where you could only go in 2 days a week, because this is predicated on an idea that this would reduce transmission. But there was a lot of evidence to suggest this could make it even worse. Because instead, when the kids weren't in school, the assumption was, well, they're all just going to be locked at home. But again, that's not what happens. That might work for a week or 2 weeks. There was never any chance that was going to work over a long period of time. And sure enough, that's exactly what the evidence showed, that We knew this before the pandemic, we knew it in real time, and even retrospectively, you can look. There was never any benefit of school closures. There was never any benefit of these hybrid models where they could only go in part-time. The overall community case rates were the same in those areas versus matched communities that weren't doing these things. So the whole idea of the kind of trade-off that you were talking about, where it's like, well, all of society needs to get together and do this thing. There's a collective action problem. Even that was predicated on a false idea that if we all do this, then there will be a benefit. Maybe we can talk about it. That's a separate issue. Some people still might disagree with that idea ethically, but at least that's something to be discussed. But that was never even the case with this. There wasn't even going to be a benefit of this collective action because these interventions were never going to work from the beginning.
Yeah, astonishing. You talk about, this trade-off of risk and safety and benefits and so forth. If we want to reduce the number of car accidents and deaths, you just lower the speed limit from 70 to 50. This was actually done, by the way, back in the 70s. You're too young to remember this, but they reduced the speed limit to 55 miles an hour, not for safety, but to save gas.
Gas miles,
during the gas
right.
crisis, right? And the people were not happy about this at all, including me. But you're
exactly right with the mileage, and I talk about that in the book because part of the argument that people kept making was, well, we need to keep kids safe, or or more broadly, people need to be safe. But that's not how society conducts itself. There's a reason why we tolerate the speed limit being 55 or 65 or more in much of the country on the highway. Even though we know more people will die from that versus if we made it 35, we could just have little country roads where you're only allowed to go 35 miles per hour. Instead, we have a massive interstate highway system where people can drive 55 or 65. Why? Because we are willing as a society to tolerate a certain amount of deaths in order to have the advantages that a highway system brings. So the idea that tolerating even one death, Andrew Cuomo said, if we could save just one life. Well, in order to save that one life, you are most likely going to take other lives. And we saw this when you look at the excess death data, that in order to prevent COVID deaths, or at least try to prevent COVID deaths, you end up introducing a whole constellation of other problems, including people weren't getting cancer screenings anymore, including people who had appendicitis were waiting to go to the hospital. There are studies on this. They waited and waited until it was an emergency where it could have been resolved more safely earlier. There's a whole long list of things that people, and not to mention, as you touched on before, depression, loneliness, anxiety, alcoholism, all of these things, overeating, undereating, where kids were anorexic, all of these things were happening as a result of these interventions, what we call iatrogenesis, where the actual cure causes its own harm. That's what was happening in America. And there was this extraordinary sort of dismissal of it in much of our country while it was going on. And the purpose of my book is I'm trying to create a historical record because right now, the narrative amongst most of the sort of elite in our culture is, well, this was regrettable, but an understandable thing to do. It was a fog of war. We didn't know, but we did know. And this information was ignored. And I try to explain through psychology, sociology, philosophy, how did it come to pass that we had something where the experts were ignoring the real evidence, what was going on? How did this actually happen?
Yeah, if Cuomo's goal is to save one life, he could have just banned swimming pools everywhere in New York.
That's right. That's right. More kids died drowning in a given year than they did from COVID in a given year.
Yeah.
Far more.
Speak to the American culture of safetyism, precautionary principle, coddling, helicopter parenting, victimhood culture you discuss, Jonathan Haidt and Greg Lukianoff's book, Coddling the American Mind. But more broadly, were we more risk averse than some of these European countries? So even though the data was surely available, it was still like, well, but we better be super careful just in case.
Yeah. I have a whole section on safetyism, as you mentioned, and there's something, and I think it's particular to the left in America, where there is this idea of coddling of children and this idea that they are these delicate, vulnerable creatures, and we must keep them sequestered and safe from all things. But again, this goes back to the, highway speed limits thing. A certain number of kids every year die going to school. Maybe it's on the road in a car on the way there, as a car accident. Maybe something horrible happens at school itself. Maybe they're bullied in school and commit suicide. There are many things that can happen that are bad as a result of going to school normally, but we don't close schools because those things exist. Millions of parents still send their children to school anyway, because we know the odds are their kid's going to be okay, and the odds are that it's better to go to school than not to go to school because you're afraid of these things happening, these anomalies. But yet that was flipped on its head during the pandemic. Instead, there was zero tolerance for any sort of harm whatsoever, or perceived harm, of going to school. So all of this kind of safetyism really, to use a word, infected the populace and the way they thought about things. And again, I keep hammering this point. The real shame of it is none of these interventions were actually beneficial. We could actually talk about this if there was some sort of trade-off, but there weren't even trade-offs. It was only harm from doing this. And, there's a long section where I interviewed a bunch of philosophers about the precautionary principle. And in philosophy, many philosophers don't even accept the precautionary principle at all as a concept, because it's predicated on an idea that you actually have more information than you have. You're already making assumptions. When you employ the precautionary principle, you are assuming that there's going to be a certain amount of harm from doing something, and that there will be less harm from not doing that thing or from doing something else. It's built on assumptions, and that's against evidence. This is part of another thing that I talk about in the book, which is this argument from authority, which is a logical fallacy, as you surely know, that simply because the person who's saying something says it, that doesn't make it true. But yet over and over, that's what we were told during the pandemic. It was incredibly infantilizing to the public. The message basically was, you're a bunch of fucking idiots. Don't listen, don't do your own research. That means you're stupid. You need to listen to us. It's like a mom saying, because I said so. That's it. That's how we were treated, the adults in our society. And they weren't given evidence. It was just, well, because the experts say this. But then you read the article, and I have lots of examples in the New York Times. It would say, experts say, ... but there was never any evidence behind that claim. Or they would even give someone's name, but they wouldn't actually press them. Well, what's the evidence for saying we need to do this? They didn't bother to do that. So we lived in an environment where we had these arguments from authority, where we were told just listen to the experts and shut up, and where we were told that there was this kind of false sort of cost benefit, but there never was a cost benefit that was actually hashed out. You weren't allowed to think that through. They just said there was an assumption to just stay home and do these things, that there was an assumption that this was going to be better, even though this was the most anti-scientific way of conducting ourselves that we could think through. And what I hope is that when people read the book, and obviously your audience is already skeptical, so this will, but even for people who already are coming at this through a particular lens and background, the book arms you, I think, and you can, share your thoughts on this. It arms people with a lot of information about how things work, how the gears turn, that if you already are a skeptical person to begin with, this provides you with concrete examples in so many ways about why that's so important to have that type of skeptical disposition.
Yeah. Yeah, the precautionary principle, I bring this up regarding climate change. I accept anthropogenic global warming, it's real, human caused and so forth. You don't know that it's going to be existentially catastrophic by the year, pick it, 2100, 2050, 12 years from now. We just really don't know that. We should do something about it, but we should also balance the costs of what it takes
That's right.
to make those kinds of changes. This is Bjorn Lomborg's point all along.
Yeah, he's great.
So that's a super important point. Also, the climate projections are also made on models rather than studies, and I loved your discussion. So just make the distinction between models and studies and what happened.
Yeah. So as people remember, there was this flatten the curve meme that we talked about, and there were lots of models put out. There's a place, Imperial College of London, IHME, which is out of Washington State. These very prestigious universities that were putting out models that Deborah Birx, who ran our COVID response, and Anthony Fauci and others, they mentioned them by name. They were looking at these models for guidance on what to do and what was going to happen in the pandemic. These models were built on extraordinarily dubious assumptions. And I have a whole section called Seductive Models. And there's a chapter about GIGO, which is the acronym for garbage in, garbage out. And that's what models can say whatever you want them to say, because the person who creates the model gets to decide what goes in and what doesn't go in. So if the model gives you an answer you don't like, okay, well, we're just going to change what we're going to put in the model. And what the American public doesn't realize, oftentimes these models were referred to as studies. Well, a study was done by Imperial College. It's not a study. A study is of information that already exists, and you're making an assessment of it. These are predictions. These are predictive models. And to me, I don't want to give away too much in the book, but one of the most profound commentaries on the failure of the experts during the pandemic is that anyone who met certain criteria could have their models included in this ensemble of models that the CDC referred to. And a study was done that, as far as I'm aware, virtually no one has reported on this. So my book, it will be new to almost everyone, and this is extraordinary, that a random guy, a software consultant, a physicist in Canada, and some financial consulting group, they were 3 of the top 4 most accurate modelers were these, basically, to be frank about it, randos. These are a bunch of people, and they beat out the experts from Columbia University, people from Harvard, people from IHME, people from the Los Alamos lab. All of the experts, these people have spent their entire professional lives in public health, we're public health experts, did worse than a guy who's a software consultant. How extraordinary of a statement is that about the failure of expertise, that these people who had zero experience in public health were more accurate than these people who run these labs, who at IHME has gotten millions and millions and millions of dollars from Bill Gates and his foundations, and they did worse off. So the models, and I know we'll run out of time on this. I read everything, and what you find is that the model, I'm like, oh, well, that has a claim in it about such and such happening, and there's citations. So then I click on the citation. Okay, well, the citation takes you to another model, which is not real data. And then that one and it's model after, I likened it to the Russian dolls, where but they never ended. You just kept opening another doll inside of a doll inside of a doll. And finally, at the end, there was one trail that I was tracking down, and I finally made it to an actual study. And deep in the supplement of that study, they were talking about this percentage of transmission that they had said was likely to occur in schools. And they said, this number, this is in the supplement, and a little thing said, this number was chosen arbitrarily. And it's hard to express how wild that is, that the models that our entire pandemic response were built on were made on these incredibly, incredibly dubious and unstable assumptions, including in this one circumstance, an arbitrary number, a number that was made up. But yet we were told, listen to the experts. So the models were such an important failure point within the pandemic. They were given an incredible amount of deference. They were cited by our officials for why we were doing the things we had to do, yet these models were never based in reality at all.
All right, last big question here.
Sure.
Do you think the institutions in our country have learned their lesson? I mean, we're at an all-time public low in trust in our medical institutions, in scientific institutions in general. When the next pandemic happens, because it will, Do you think they've learned their lesson on this and they'll take a different approach?
Unfortunately, to a degree, it's going to depend who's in charge. But even regardless of who's in charge, unfortunately, we can still see this today. What I would argue, look, and I'm not someone who's saying I agree with everything that RFK Jr. says, but the vilification that occurs because anyone on the left for generations has talked about getting chemicals out of our food, trying to eat more healthily. Yet now, because RFK Jr. has now become a turncoat and he's on the wrong side, now everyone's against him. Now, whether you agree with his stance on vaccines or not, let's set that aside. That doesn't mean that he's not right on chemicals in food and wanting people to eat healthily, but even that now is thrown out. So to me, it's suggestive that this tribalism that we see within people in public health and more broadly within the sort of legacy media, this kind of incredible groupthink and tribalism has not gone away. And unfortunately, these institutions tend to self-select for a certain type of person. And many of them are very smart. Many of them are hardworking, but they also tend to not be independent thinkers because how do you get to the New York Times? How do you get to be in an influential position at a university hospital? By and large, you get there by not ruffling feathers. You get there by knowing how to play the game and how to be an insider. So those people don't well tolerate people with outside ideas.
Do you think anybody should pay a price for their errors, their lies, their distortions that cost us so dearly?
I think there's something very seductive about the idea of people being punished. I think it's incredibly hard. As we know, Fauci was already pardoned. um, for me personally, I'm not interested in retribution. To me, what's most important, why I spent years writing this book and with hundreds of endnotes in it and went to the ends of the earth reading study after study after study. The reason I did that was, to me, the best sort of, and this isn't the right word, but the best revenge and at least the best preparation for us as citizens, for your audience, people who are skeptical about things, the best thing we can do is to be prepared and to know, to have an awareness, a critical lens through which you can view what's happening. And I hope that my book, it's basically a series of case studies that through going through all of these case studies, you have this kind of mental model in your head of all of these examples about what's happening, of how those gears are turning behind the scenes. So you are prepared the next time. And it doesn't even have to be a pandemic. During whatever crisis, and there's always a crisis, during that next crisis, you're going to have that model, that lens through which to see what's going on.
Nice. There it is. An abundance of caution, American schools, the virus, and a story of bad decisions. It's a gripping read. Really good. Like a detective story. I loved it.
Thank you so much,
by the
Michael.
way, it's MIT Press. This is not some, bogus fringe. It's not a fringe publisher.
No, not a fringe publisher. Not yet.
It's like I spent a week in Italy with Jay Bhattacharya at this conference sponsored by Peter Thiel. Yeah, it was super interesting. He's the nicest guy in the world and so smart, so thoughtful, deeply read. It's like, and then everybody was joking around like, you got to get a business card that says fringe epidemiologist.
Right.
I mean, that Anthony Fauci called him that. That's terrible.
Yeah, well, that was the infamous Francis Collins email, which I believe
Francis Collins, that's right.
Yeah, but he sent it to Fauci. I believe he subsequently has apologized. But the broader dynamic of that, unfortunately, is still at play. And I think, and what I talk about in the book is a lot of this simply is human nature. And there's only a certain portion of the public who really are independent thinkers, who have a tolerance for being in the out group. And as I was just talking about with you, these institutions tend to self-select for certain types of people. And in many ways, that self-selection is good. You want your doctor to be hardworking. You want your doctor to be really bright. And many times following rules is the best path. But unfortunately, in circumstances like this, you end up with a result where there is zero tolerance for anyone to disagree. And that's how we end up in this circumstance. So hopefully people will read my book. I'm very easy to find online, by the way. So any of your audience, after you buy the book, feel free to reach out to me. I love hearing from people. We can talk about it. We can get into it if you have any questions. But I appreciate your endorsement there on the book. I have been told that it takes often very complex topics, and I make them readable. I make
totally.
it's an easy read where you can understand what's going on.
No, I much prefer reading books by people like you rather than most academics are not
Yeah.
good writers like you
No.
are. Where do they find Silent Lunch? Is that a Substack or what is
It is. So it's
Yeah.
silentlunch.net. And that's actually an homage to during the pandemic, they did not allow children to speak during lunch. Because the virus stopped when you're eating, it's okay, but when you speak, so in many schools they had a silent lunch, so I named it as an homage. So silentlunch.net, and my website is davidzweig.com, DAVIDZWEIG.com, and I'm also on X at David Zweig.
Nice.
So
Yeah, I
easy to
tagged it.
find.
I gave you a nice plug on Twitter the other day. All right, David, thank you so much.